Today, we are covering respiratory assessment, a topic that is guaranteed to appear on your nursing exam. Let's begin with inspection. The exam won't just ask you to look at a patient. It will test if you can identify subtle but critical signs of distress. For example, a question might describe a patient leaning over their bedside table. This isn't just a posture, it's the tripod position, a sign the patient is using every muscle they can to breathe. You must also look for the use of accessory muscles. Seeing the sternocleidomastoid muscles in the neck contracting with each breath is a red flag for significant respiratory effort. Another key inspection point is chest expansion. If a question describes unequal or asymmetrical chest rise, your mind should immediately go to conditions like pneumothorax or atelectasis, where one lung is not inflating properly. This is a classic exam scenario. Next is auscultation, a huge component of the NCLEX. You need to know the difference between adventitious lung sounds and what they mean for patient care. Let's start with the most critical sound, stridor. This is a high-pitched, inspiratory crowing sound that indicates a severe airway obstruction. If you have a prioritization question with 4 patients and one has stridor, that is always your first priority. It's a medical emergency. Then we have wheezes, which are high-pitched whistling sounds typically heard on expiration. When you hear wheezes, think bronchoconstriction, as seen in asthma. The expected intervention on the exam would be a bronchodilator like albuterol. Crackles, sometimes called rails, are popping sounds. Fine crackles often point to fluid in the alveoli, classic for heart failure or pulmonary edema. The exam answer you should look for is a diuretic. Coarse crackles, or rhonchi, are lower-pitched rattling sounds that suggest secretions in the larger airways, meaning the priority action is to help the patient clear them, perhaps by coughing or suctioning. Here's a phrase to help you remember. Wheezes are a tight squeeze. Crackles mean fluid tackles. Rhonchi rumble from secretions, but a stridor is an emergency expedition. Now let's talk about interpreting data, a favorite NCLEX trap. A question might state a patient's pulse oximetry is 95%. This seems normal, but the trick is in the details. If the patient is on a non-rebreather mask at 15 liters to maintain that saturation, they are not stable. They are working incredibly hard and are at risk of decompensating. The exam is testing your ability to synthesize all the data, not just one value. Similarly, with arterial blood gases, focus on the basics. Respiratory acidosis means a low pH and a high PaCO2 from retaining carbon dioxide. The cause is hypoventilation. The correct exam answer will be an intervention to improve ventilation, like BiPAP, not just supplemental oxygen. Respiratory alkalosis is a high pH and low PaCO2 from blowing off too much carbon dioxide during hyperventilation. Your priority is to treat the underlying cause, such as anxiety or pain. Ultimately, every respiratory assessment question boils down to safety and prioritization using the Airway, breathing, circulation framework. The NCLEX will test your ability to identify the sickest patient, the patient with a compromised airway, like the one with stridor, or the one showing new onset confusion with a falling oxygen saturation, is always the one you must address first. Master these assessment skills, and you will be prepared to tackle any respiratory question the exam throws at you.